Thanks for the reminder, Sarah.
Excellent.
And we even discussed not forgetting the recording, so thank you very much. I've just started. Thanks very much for that introduction, Yemi. Welcome everyone, my name is Laura Keane, and I'm so happy to have you all here today so we can share the findings of our research on the use of storytelling to motivate citizen engagement and action. So I am going to, can you see my screen all right?
Yes, we can.
Okay, wonderful. So the agenda for this presentation is first to discuss the research question that we were seeking to answer and the methodology we used. Then we will be treated to a reading from Dike Chukwumerije of the story that he wrote that depicted the events that you saw in the video that we showed first. And then we're going to discuss some of the key findings that we found in the process of realizing this research. And then we hope the bulk of the conversation can really be a discussion to understand how all of you, practitioners in your fields and researchers and experts, use storytelling in your own work, and what we might all hope to learn from each other's experiences in that field. So beginning with our research question, this study was really motivated by a lack of evidence on the effectiveness of storytelling at motivating citizen engagement. We knew that a number of our partners were using storytelling, but we lacked an evidence base around what methods of storytelling could first help to improve citizen knowledge of scheduled projects in their community and participation methods to improve project completion. And second, how the use of storytelling could promote citizen engagement in participation and accountability mechanisms. So we used a three-part research agenda. We began with a literature review to try to understand what existing evidence there was about storytelling, the different methodologies that were used, and particularly how storytelling had been applied in the past to anti-corruption work. We then supplemented that with key informant interviews to discuss with various CSOs in Nigeria the ways in which they use storytelling in their work and the lessons that they've learned in the process. And I'm happy to report that many of the experts that we discussed this with are in attendance here today to continue to share their expertise. And then finally, we conducted focus group discussions and a survey to test different methods of storytelling and to solicit feedback in real time from participants about which elements of the storytelling resonated most with them and why. The findings from our literature review informed the different methods of storytelling that we tested. So we had three methodologies that you'll see we tested in our focus groups, and they were first narrative policy. And the idea with narrative policy is that you have a really sort of classical story framework where there is a setting, a set of characters, you have villains, heroes, victims, and then you have a context and a plot that connects very well to your policy setting. Methodology B was narrative policy with biography, which in the literature is referred to as biographic narrative interpretive method. And this method uses a prompt, a question that elicits from participants a personal narrative about their own experience with the particular policy question. In this case, we asked people to share around a personal time that they had struggled to access primary health care. And then methodology C was narrative policy with a parable. And in the literature, this is referred to as community-based participatory research. And this is the use of traditional or shared stories and practices that are common within a cultural context to elicit a response from the viewers or hearers of the story. So the parable that we chose was based on its cultural relevance and message of persistence. So we selected an ant on its feet can do more than an elephant lying down. In that second stage, those key informant interviews that we realized, we talked with 5 different organizations, 4 local to Nigeria and 1 international funder organization with a Nigerian arm, to get recommendations from them about their own use of storytelling to inform the content of the story that we would test and also our delivery. The 5 key recommendations they made to us were, first, that the audience is the most important factor in determining a storytelling approach. So that includes things like where the story is told, what medium it's shared with, so whether it's verbal, video, something written that they read, and also the setting. Is it a quiet setting? Is it in a bustling setting? And how will that resonate with people? The story must be relevant and of interest to the community. They must have a personal stake in whatever is being told to them to really engage them in the content. Third, it should have a clear call to action, and the call to action should be both reflected in the actions taken by the characters in the stories themselves, and it should be feasible and realistic for participants to realize in their own lives. Fourth, the context of the storytelling is key. So there could be a larger cultural event happening at the same time that could help to heighten the emotions within your story, or conversely, a competing event happening might distract participants or dilute the message of the story. And then finally, it's important to capture feedback from your audience on the resonance of the story, which could take place immediately following it, or in a more nuanced way by reading body language, reading facial language, and understanding how what you're saying is resonating with your audience. So based on the findings from the literature review and those key informant interviews, we selected 3 different methodologies and then convened focus groups structured to compare the effectiveness and the ability of these different methodologies to motivate action. So we had a total of 48 different participants and 12 focus groups, 6 in Lagos and 6 in Abuja, divided by gender. The participants were recruited using convenience and purposive sampling, and they were screened on their ability to speak and understand English. They were between 21 and 65 years old. And most crucially, they were users of public health facilities, because as we learned, in order for the story to really resonate with them, it needed to depict a service that they themselves had experience seeking to access. They were recruited through local partner organizations, and this is our wonderful facilitator, Amy, depicted in this photo. We assessed change in knowledge and motivation through a before and after survey. So prior to hearing any stories, participants were surveyed on their knowledge of certain budget allocation processes, on their motivation to take action in their community, and also on their understanding of how to take action in their community. Then participants in Group A heard just the story that you're about to hear. Participants in Group B were first prompted to speak about a personal time that they had struggled to access healthcare, and then they heard the story. And participants in Group C were told the parable of the ant on its feet being stronger than the elephant on its back, and then were told the story. They were then surveyed with the same questions they had received initially, and then we engaged in an hour focus group to get more details about their enjoyment of the story. And with that, I will pass it to Yemi.
Thank you very much, Laura. So it is my distinct privilege. We thought we were going to have, if you could stop sharing your screen so that we could get a full view. Aha, great. We thought we were going to sort of write the story in-house and based on the human cost of corruption. But Laura had the brilliant idea that why don't we reach out to actually professional storyteller? So we did reach out to DK, and he was gracious enough to grant our request, and he crafted the story you're about to hear. DK, over to you. Thank you very much.
Thank you. Let me just be sure that I can be heard.
Yes, you can.
Thank you. Machina is a town the headquarters of a local government with the same name in Yobe. It is a proud town on Nigeria's border with Niger Republic. But in Machina, there is only one public health center. It is a broken thing. No electricity, no water, no drugs, no equipment, no trained medical staff. So parents in Machina, without the option of strolling down to the local clinic for Coatem, watch their children die of malaria. This is true. Abdul Husseini was only 9 months old when he breathed his last. Malam Mohammed was 60. But a bad stomach and an aching back should not be the cause of death of any old man in any community in Nigeria. But it is routinely in Machina. Because the health center, were it even unbroken, cannot adequately serve the 15,000 men, women, and children that need it in Machina. Yet, since 2017, the Border Communities Development Agency, BCDA, has had funds budgeted for a second, better equipped primary healthcare center in Machina. Imagine, this is not common knowledge in Machina. It was only discovered when CODE, a non-governmental organization based in Abuja, or passionate about the plight of Machina, began to sniff around. They asked the community if they were aware of the project. The community said no. They wrote to the BCDA asking for details of the project. The BCDA was silent. They petitioned the supervising government agencies about the non-execution of the project. The agencies said and did nothing. Yet, every day, Nigerian women in towns like Machina are going into labor, not sure if they will come out. Yes, without doubt, this tendency of Nigerian public officials to reroute public funds away from public needs and into private pockets is the reason a mother will die in labor in Machina today. Yes. Unless we do something. Imagine, interpret the story of, and along with CODE, went to Machina to interview people there. These interviews were recorded. Imagine this. Imagine if this recording is shared and forwarded, tweeted and retweeted so that more people see it. Imagine if people in Machina, in Yobe, from all around Nigeria, begin to call the legislators representing Machina. Imagine if the phone numbers of these representatives go viral. Imagine if Aisha gets her friends together and they draw up a schedule to make sure calls and text messages about Machina keep pouring into these phones every day. Imagine if Ahmed asks his father to go with him to visit the emir. Imagine if they appeal to the emir and he agrees to pressure their representatives too. Imagine if the deaths of Baby Husseini and Baba Muhammad are put on the ballot. Imagine if a senator or a member of the House of Representatives, if a governor or a member of the State House of Assembly in Machina loses their office simply because an Amina or a Fatima, a Hassana or an Asabe went to give birth and for the lack of basic health care never came back. Imagine. Yes, imagine. For this is what will then happen. The representatives of Machina will stand over the shoulders of the BCDA, and the BCDA will start the construction, continue the construction, and finish the construction of a second, better equipped public health center in Machina. so that the next 9-month-old baby who goes down with malaria and machina, unlike Abdul Husseini before him, will get up again and go on to live out the length of his days in dignity. Yes, this is what will happen if you and me engage. Thank you.
Thank you so much for that, DK. That was really beautiful. We're very grateful to have you here to read it for us. And as was the case with our participants who heard this story from Amy, the story resonated with people quite a bit. And I'm happy now to share some of the findings that we had from our focus groups. So I'm just going to share my screen again. So participants, and I'll just clarify, the numbers at the end in parentheses are the number of times each of these themes was mentioned by one of the respondents in the group. So we had a total sample size of 48. So 27 of the 48 mentioned this theme. So the participants found the story to be sad, but the action inspiring. They talked about the pathetic nature of the story, or how sad it was because innocent people were dying from minor or preventable illnesses. But a large group also thought it was quite inspiring because people came together and demanded improvements. Related to our recommendations from our key experts, the story was realistic and representative of similar situations elsewhere in Nigeria, which is one of their recommendations for us. One person said, quote, "This story is so saddening. It is not a sweet story at all. Innocent souls, both young and old, especially the pregnant women dying because of the failure of things not being done properly." Also reflected in the recommendations from our key experts, the importance of listeners or viewers relating with the characters was really highlighted. And many of the participants in our focus groups related to the pregnant women, they related to the baby who died of malaria, and some others also related to CODE, the NGO, because they intervened to improve the situation. When asked to reflect about what the story was about, many recognized a call to action in the plot. They thought the story was about how important it is for people to be educated and aware of what's going on in their communities, and that everyone is responsible for doing their part. They also thought it reflected a high level of government mismanagement, corruption, and bad leadership. And some others thought it was about how dilapidated the health system is in Nigeria. One person said, "The government is not doing their work, not healthcare. Then it is asking us to imagine if things can be better. So I think it's a call to action to hold them responsible, because in as much as we can point out all the issues, the story makes it feel like on our own part, we are just keeping quiet. We are not doing anything. So I think the biggest lesson from the story is be willing to start doing something." Respondents loved the composition, length, and delivery. They thought it was easy to understand, well-written, informative, and interesting to listen to. A small group thought it could have benefited from greater detail into where the process breakdown occurred and what the people should do next. The majority thought that the story was well delivered, clearly enunciated, and well paced, and many loved that the storyteller's gestures really brought it to life. They also thought that the story was the correct length. They thought it might have been long, but it was interesting enough to warrant the length. Multiple talked about how they forgot it was a story while listening to it, and felt themselves becoming very immersed in the content. Different methodologies elicited some nuance. So as you'll recall, we were testing 3 different methodologies. All of the participants heard the story that you just heard. Some also were prompted in methodology B to share a personal account of a time that they had struggled to access healthcare. And so, as we would expect, in group B, we had many more people sharing personal health stories than we had in groups A and C. And we had one person sharing a story of a struggle to access healthcare, eliciting a similar response in others. So it became a bit one story begat another and people would share more. And then methodology C, perhaps because the proverb was told before the story, and then the resonance of the story overtook it a little bit or overshadowed it. We only had one group out of the 4 that heard the proverb reference it later on in subsequent discussion. So one reflection on this is that perhaps the proverb, to properly test it in differentiation from these other methodologies, should stand alone. So next, I'm going to share on findings of understanding of budget processes and actions to take, because this was a key part of our research question. How can we use storytelling to share information about something like budget tracking and the steps people can take to ensure that it happens? So we found that our story did not educate about budget allocation processes. The participants felt like they didn't understand at the end how the budget is allocated to different branches of government and how it moves from one to the other, and thought instead it was more focused on the predicament of those who were impacted by that budget breakdown. But it did show respondents that they have a right to participate. So the majority said that they learned that action is possible. They learned that they have a right to be involved in the oversight of projects in their community, and they should speak out. They also learned that in a similar situation, they could contact their representative or an organization like Code for help. But they thought that certain details were missing. So they thought it lacked concrete actions that citizens could take. They talked about wanting to know whom to call, what's the number to dial, what person should I ask for? Next, I'm going to talk about findings on change in motivation, which was a very important topic to study for us.
No, I did.
So the majority of respondents said the story inspired them to take action. They were motivated to do something similar in their own communities after hearing about the success of these characters. Many also expressed the belief that ordinary people are capable of bringing about positive change through collective action. One individual said, "So even before now, I have been thinking about it that I am going to attend the CDA meeting, but now I will surely go. I will visit that place because the truth of the matter is, if you are silent, if you are inactive, you will not know what is going on. But if you attend the meeting, if they want to share money, you will know. Where the source of the money is coming from, you will know. So you will be better able to know the right step that you will take to better your society." But respondents noted that barriers to taking action are prevalent. Many referenced their fear of government surveillance or retaliation if they were to speak out or take action. Others talked about practical obstacles and barriers, such as getting a hold of elected officials once they are in office and no longer campaigning. Some talked about how even if you do manage to contact them, they will just ignore the complaints. Others talked about larger democratic issues, such as elected officials being hand-selected and beholden to political godfathers and not the people. And then a small group talked about, again, not having concrete information about how to participate if they wanted to. Related to the topic of officials being hard to contact, one person said, "The people that elected them have been entirely sidelined from the governance. I have the number of the senator representing my locality. I have had it since March and the number has been busy till today." So putting this all together, there are a couple of salient conclusions that we take. So first, the audience is the most important factor in designing the approach. This story will be very successful at targeting a community with something personal at stake. So in this case, we were telling the story to individuals who would also be highly impacted by access to public health clinics. And as a result, the audience knew what it was like to not be able to access healthcare and saw themselves reflected in these characters. It was also very important to have relatable characters in the story who overcame obstacles to achieve collective goals. And the participants found this to be very inspiring. And then finally, the emphatic delivery, very colloquial language, and the quiet setting in which they heard the story really allowed them to become immersed in the narrative. Next, we recommend that storytelling, at least in this case, can be really useful to make people feel something, to generate emotion, and then clear calls to action can come later. So when we were designing this story, we weighed whether we wanted to prioritize inspiring a feeling and producing motivation rather than communicating information and actions to take. So when participants noted that they lacked concrete details, such as whom to call, this was a trade-off that we decided was important to make because we worried that sharing very specific tailored details about how to engage would prove challenging and likely make the story lose momentum. So instead, our reflections are that it's best to, in this case, it could be best to provide opportunities for participation immediately following the storytelling to take advantage of the increased motivation. So for example, here's a sign-up sheet to learn more about budget allocation in your community. This is a number for a representative for you to call. Follow these steps to get in touch with them. And then finally, we saw that low social trust, as we have identified and studied in other pieces of research ongoing in Nigeria, can really inhibit action. There are some individuals, and this was reflected in the data, that will never be motivated to take action in their communities. They're unpersuaded that it will make a difference and are not willing to take on the personal risk. For others, the difference can be how easy you make the next step. And so we're building on prior research from Betsy Levy-Pollock, who found that there were large increases in the use of a corruption reporting app in Nigeria when participants were sent a text nudge reminding them that they could submit their report and allowing them to submit it directly to this text message campaign. And as evidenced by participants' worries about their personal safety or fear of retaliation, it's also important to provide a very low means of participation that are less likely to expose them to violence or personal risk. So with that, I will pause and hand it over to Yemi again.
Thank you, Laura. And welcome again, those who've joined us since we started. I just did a recap in the chat, so feel free to look in there to see what you've missed as you joined. We watched a movie which provided some context. We've gone through the research question and methodologies. We've heard the reading of the case study story by DK, and Laura just finished presenting the findings from the focus group discussions. So we're now going to open the floor for conversation, for feedback, for discussion really about the research, the methodology, the story, anything that you've heard and other things that you know that you'd like to share. We have people joining from, I think, 2 or 3 continents, so quite exciting. But before we do that, I'd really like to, I see a hand raised. Thank you very much, Jessica. We'll get to you in 1 minute. But wanted to just have DK open the floor. One, he helped craft the story that you heard. Secondly, he writes stories for a living, and his stories have been quite impactful as people are quite emotive. That's the word I was looking for. His stories are quite emotive. So I wanted to have him share some reflections of impactful storytelling. So over to you, DK.
Thank you, Yemi. Well, that was very interesting for me, listening to that research and hearing some of these things sort of put in black and white, some things that you sort of know intuitively or just know from writing stories, trying to engage with social issues over the years, and particularly that dichotomy between inspiring people, creating an emotion, a feeling, and makes them want to do more, and then telling them exactly what to do. It can be difficult to achieve both in one story, you know. So oftentimes you have to make that compromise, and usually the first thing you're trying to do is to motivate, to inspire, because like the research rightly points out, there are very, very high levels of demotivation in the Nigerian society. Some people just feel there is no point. There is, you know, we know the problem, but there's no point in acting. You know, and sometimes you struggle with, well, should we focus on the people who still have some level of motivation, or should we try and because there's a thing about critical mass. If enough people don't get on board, then it's not going to work. So you really have to try and move some people from the demotivated category to the motivated category, which is one of the reasons why personally I've invested a lot in writing emotive stories that don't really seem to tell you exactly what to do, but just tries to awaken something within you that says, I want to do something about this. And like you very rightly hit upon, it's about focusing on the humanity of the story, so that the listener or the reader can see themselves in that story. Usually when I write stories, I like to have touched or been in the space I'm about to write about. Because when I experience it myself, I'm able to infuse it with even more emotion. But then from experience, sometimes when you read a text that somebody sends to you, you're able to imagine, you're able to really imagine the humanity in the text and see how you can sort of fill that out and draw that out, which was what happened with this story. I guess I'm not adding any new insights, just reiterating some of the things that we already said. That for me, I think it's important to try and motivate Nigerians to even care. And then when you have a group of people that care, then it's easier to start saying, okay, this is what we can do. This is what we can do. So if you write a story and you have more and more people saying, which has happened, because I go around this country telling stories, and sometimes I get the feedback, listen, where you come here, we're all fired up, but we don't know what to do. Okay, what's next? How do we do this? And I think it's even a good thing to build that hunger, to just build that eagerness to want to do something, whatever the solution appears. So this was a really pleasurable exercise for me. It was more than an exercise because it's also real. Knowing that this is real, it happens every day, and every Nigerian knows this. And for me as a storyteller, trying to put that ability to service of humanity, so you're not just writing stories to entertain, but you're really writing stories to move people to positive action. So I was really happy to participate in this, and also very insightful listening to all the findings from the research, hearing it put in black and white like that. So thank you very much, Yemi.
Thank you very much, TK. And it's gratifying to hear that sort of academic research, quote unquote, sort of validates what you've known intuitively because this is what you do. But also, I like the point that you ended on is that your stories are deliberately emotive, but also not prescriptive. So it's really meant to get people awakened and get them to want to do something. And because again, contexts differ, people's capacities and abilities differ. And as Laura said, it's one thing that we didn't factor in. So even though we didn't, the next step is not embedded in the story for length and other considerations, we didn't sort of capture that energy of those who wanted to do something in sort of helping them navigate that. So thank you very much. And please do stay on the call if you can while we take on questions and comments for others. I don't know, sorry, Laura, I don't know if you had any comments for or questions for DK.
No, I just really appreciate you sharing those reflections, and they really resonate with me and mirror to Yemi's point what we saw in the black and white research. So thank you so much for your time on that. And we opened it up to questions, and we had some questions prepared, but maybe first we can just go to those who have their hands raised. I think
Great.
Jessica.
Okay,
Amy,
thank you.
video on. So sorry, Jessica. So we can add you to the panel as our focus group consultant as well. Please, Jessica, go ahead.
Thank you very much. I enjoyed listening to that, and I've always been a fan of tugging at emotion, sometimes a bit more than maybe tugging at the intellect of Nigerians. But my question is, I know that there were 3 different types of strategies implemented for this. I just wanted to ask if you noticed maybe some working a bit better with different demographics. Since Nigeria is full of different cultures and sentiments, I just wanted to know if there's a better way to tell a story in a particular region as compared to another, so as to enable us to know how to target the stories we make. Thank you.
Yeah, I can start on that.
Before you introduce yourself, or before you ask your question or provide your comment, could you just tell us where you, either what organization or who you're affiliated with? So Jessica, if you don't mind.
Oh, sorry, forgive my manners. My name is Jessica Ojudu. I work with the Premium Times Center for Investigative Journalism. Thank you.
Thank you.
Yeah, thank you very much for your question, Jessica. So we had, first we had the three different methodologies that we were testing, and the different variables that we stratified on when we were analyzing the data afterwards were gender and location. So we looked at the numbers by whether they were in Lagos or Abuja, and whether male or female, and whether they had received methodology A, B, and C. And we were not able to derive a really coherent set of conclusions from that analysis. We picked up some things based on, for example, whether a community had experienced more of the NSARS protests, and how that might have impacted their likelihood of talking about a fear of retaliation as something that would inhibit their action. Others were more familiar with code because of the location of its office. So what our conclusion was from that is that these variables, gender, location, just strictly looking at Abuja and Lagos, might have been important or differentiating in a different context or with a different story, but in this case, they weren't the right variables. Perhaps if we were to do it again, to your point, we could look at things like different primary language groups, have more geographical representation to see how the story resonated in different ways. But the conclusion we came away from this research with was that these stories were powerful across these groups, and the variation was hard to tease out.
Thank you, Laura. Second will be Sarah. You go ahead and unmute yourself.
Thanks. Enough is enough. Yemi, Laura, R4D for this work. Also, thanks to DK. DK is a pretty big deal, and if folks know that, so it's really special to have him read that story to us. Thank you for all the work and telling stories. So one of the questions I have is, some people won't get the chance of, oh, sorry, and you had told us that before. My name is Sarah Makogbabe. I'm the Executive Director for Engagement and Mobilization at the One Campaign. So a lot of the ways in which we engage people through these emotive stories and action taking is through digital. We wouldn't get a chance to sit around Zoom and listen to DK tell us a story that brings us close to tears. You'll get that story through your inbox. So did you learn anything about our new normal with COVID and digital engagement, getting that same response and reaction when there's no voice over in the room?
Amy, do you have any reflections about that?
Yes, maybe I can. Hi, everyone. My name is Amy. I was privileged to do the focus group discussions, and it was bittersweet, but mostly sweet. To answer Sarah's question about digital, I found that the more educated, exposed the participants were, the more likely they were to engage with social media. Indeed, in Abuja, where we had some students who were from some universities, they preferred the social media. They preferred that story because of the anonymity it provided for them. And this leads back to the point of fear of retaliation or fear of people getting back. But more importantly, they were younger, so they were between the ages of 21, 22. They were hip guys, you know, and for them, that was easier for them. They were their phones. We had different demographics. We had women who had children, new mothers. We had men who were working. It didn't so much mean a lot to them because I would imagine that a lot of them were from the working group, working class. They didn't have time to be reading stories. It was very over the top of their heads for them. In fact, the more I don't think I did a good job like DK did, to be honest. I did try. I pictured myself in DK's head when I was reading the stories, but at one point in time, I think I cried or I tried to, no, I cried. I didn't try to cry. But the more emotive the story was, the more engaged they were. So which brings me to conclude, and Laura, I'm sorry if you didn't, I'm saying something different. They are more engaged. So they reminded me of Tales by Moonlight. They wanted that experience. For those of you who are not Nigerians, Tales by Moonlight is where people come together and they reenact the stories. They prefer that. In fact, a few women said, oh, I wasn't emotive enough. I didn't put passion into the story. And I thought maybe I should have cut myself. Maybe that would have been more emotional for them. But to answer your question, it depends on the category of respondents. So that digital one, not yet there. I hope that helps. But it doesn't mean that it's not useful. It was.
Thank you, Amy. And it's an interesting overlap between Sarah's question and Jessica's question, because it then goes back to demographic. So as you said, for millennials, young people who are already on their phone anyway, trying to get them into a room, even though as powerful as DK's voice, what they would probably react better to is us recording DK read the poem or the story, and then share it as a link on social media, or as Sarah said, get it in their email. So they click on the video and they watch it, or they see it scrolling through Facebook, rather than going to a room to listen. Whereas, as Amy said, working class people or people who are not as engaged online, they're not going to go online. It's their lives are still offline. Let me put it that way. So they would need to be brought into that room. Thank you, Sarah. Felix, please go ahead and unmute yourself.
Thanks, Yemi and Sarah. Kind of even building on what you said. Sorry, guys. My name is Felix. I'm from R4D, based here in Abuja. So with respect to these stories, something just crossed my mind as we were just discussing about those who would have the story touch them, whether through digital media. There is this, I really don't think the demography is the only variable here. Take, for instance, there's this guy who, since the COVID era, he's a pastor somewhere in Mumbai, and he started something online. They call it NSPPD, what God cannot do does not exist. Some of us may have heard that. And on the average, every morning, sometimes you have up to 70,000 people logging on, and this is from 7 a.m. to like 8:30. And one thing he encourages those who join the prayer is to share their story, like a testimony, and they do video testimonies of like what happened to them and share. And sometimes they share this through WhatsApp, stories of how someone maybe was ill and then joined the prayer and something happened. And I've logged in a few times and I see people sending stories from US, from Canada, from places far away, not necessarily Nigerians. So I think maybe, I really don't know, but I think there could be a way that some stories can be shared in such a way that you can gain some ascendancy to an extent that people will get to connect with them. So for instance, I worked in a hospital before and I know how precarious the health system is, but we don't really hear health workers share their story about what can be done to. So the only thing we hear about possibly when resident doctors are going on strike like they currently are, or nurses or the other health workers, but the stories of Nigerians who suffer because of their poor health system, or that the fact that the government is not investing enough. And Sarah, these are stuff we've been engaging through, for instance, the Basic Healthcare Provision Fund. Nigerians possibly don't know about what has been going on. So I think the stories we package, even if we don't necessarily direct it to a particular demography, I think if we are able to find a way that we can create stories that speak to what our people are experiencing, I think it will help. Not as if I have the solution or strategy, but beyond. So even if it's digital, a lot of our people share and forward a lot of things through WhatsApp, and it just goes around and trends, and also beyond just the young demographic and those who seem to be digitally connected. But I think we necessarily have to find a way to, one, share these stories, or get our people to share their stories in one way or the other. That, yes, of course, it should be focused on maybe using different platforms or different ways to tell the story. and all. But I think there is a lot of power in storytelling. I'm not sure we are telling enough of these stories. Thank you.
Thank you, Felix. Well, definitely, I think what the research and both that we did and that even DK said does confirm is that storytelling is powerful. We should tell more stories. But the response to Sarah's question was in terms of, because it was a focus group discussion within a space, someone had to read them a story. So she was sort of asking, if they don't get someone to read them a story, what different groups, what does that mean in terms of impact? So we're just trying to say that for a particular demographic, it's more natural not to need to be in a room, and that's sort of younger people. Yes, people share things on WhatsApp. I mean, the pastor that you were talking about, again, the context is also slightly different. And I dare say, if the data on that is drilled down, you'll find that a lot of people join from outside of Nigeria or from Nigeria's urban centers. One of the things that EiE's work has shown always in terms of app penetration or people's engagement with technology is that it follows Nigeria's broadband map. So where there's broadband, you will find engagement. So that's not necessarily reflective of widespread use, which is what Amy's point is that there will still be some people who, until they hear somebody doing Tales by Moonlight or someone reading the story in a space where they're familiar, they probably wouldn't engage in that manner. The urgent second. Okay, so let's say Mr. Olusegun, please unmute yourself.
Yeah, thank you very much, Yemi, and thank you for the work done on this research. My name is Olusegun Adamolekun. I'm the Executive Director of Paradigm Leadership Support. Okay, just a quick one. I wanted to know if the findings from the research work, in any way, pointed out what actions the respondents of the focus group discussion were likely to take. Because Yemi had pointed out that, I mean, those things were not included in the story because of the length of contribution. So I wanted to also wanted you to touch on that. And
we were losing you. I don't know if Amy or Laura could hear, but I lost him for a bit.
Okay, can you hear me now?
Yes.
Maybe switch your video off. That might improve your network quality.
Okay, so I wanted to know what kind of actions the respondents were likely to take or were going to take as a result of the stories that was read to them, and whether those actions would lead to some policy reforms, and whether they are able to take those actions independently over a sustained period of time. Just so we know how this set of people who are affected by issues, are thinking, and then progressively over a period of time, and not just on one issue, but on many more issues. Thank you.
Okay. Should we allow Ray ask his question so before kind of respond?
Okay, sure. Ray, please go ahead.
Or make his comment.
Hi, everyone. Thanks for the opportunity to join in this call to ask a question. I'll just go straight to the point. I think that this is a beautiful thing. We've done something similar.
You didn't introduce yourself. Sorry, Ray.
Sorry. My name is Ray Nkum. I'm a country lead for Budget Ghana. So as part of the COVID-19 Transparency and Accountability Project, we also did some amount of storytelling, and we published videos. We are finding it hard gaining traction on some of the platforms that we've published. So I wanted to know some of the strategies that you use for disseminating the videos. Also, like I think it's Olusegun who mentioned, it's quite difficult getting a hold of the healthcare workers to get them to speak on the issue, because they have a different perspective being insiders. So that's one of the things that we wanted to do, is to kind of triangulate the story by publishing information from first-hand information from the healthcare workers. But that's very difficult, especially when there's a tense political climate. They could lose their jobs. So I wanted to know how you can navigate that, because clearly that's something that would augment the work, that would deepen the understanding of the issue. So that's the second thing. And then the last thing is we also have the feedback that it would be good for us to perhaps include some information on budgetary allocations and not come from the perspective of just asking questions and just showing the gap, but going in there to actually try to fill the gap. So we have a broken down infographic-based budgetary document that will be carrying into our conversations the next time to try to get the perspective of people as we educate them. So that's another angle that we're taking perhaps for the next round. So those are just my quick comments. Thanks.
Thank you, Ray. I'll answer Ray's comments and then Amy can take on the focus group discussion. So your starting point around budgetary, yes, definitely. And I think it was an error on our part as EiE that it's something we should have built on. So as that outside of the research, which did not include it, but making materials available for people to then follow up if they were interested, and sort of also be deliberate about curating the actions that people wanted to take and support them in that journey. It's something that we failed to do, but not lost. As we were thinking, I was like, well, we have all their details. We could actually still reach out and take that up from there. So something we could do. Secondly, you talked about nurses. I'm glad on the call is one of Nigeria's more respected investigative journalists, Fisayo. Unfortunately, you're right. I mean, given the conditions and their terms of service, it will be rare to get a public servant to speak on camera. Number one, usually you don't get them speaking until they're on strike. So it's more a collective action and people are protected by the fact that it's not only them speaking. So a way around that, really, to be honest, is only investigative journalism, where you have people sharing information from the inside that's then turned into stories to drive citizens' action. And we've seen that. I mean, there was a famous case about the Ghanaian judicial system that was brought to light by an investigative journalist. And Fisayo did a piece on the Nigerian prison system because he decided to become a prisoner and could then talk about it from experience. And lastly, you asked about the distribution of the movie. When we did it in 2018, I believe, we had a launch event for it. So invited people in the different agencies that were involved. I think we got one or two of them to show up. So that got a bit of publicity. And based on that, people, I think, watched it and it got some traction on social media. Then secondly, Code had an event leading up to the 2019 elections, if I'm not mistaken, and showing the movie was part of it's a 10-minute documentary, was part of what they did at the beginning. EiE as an organization is also something we do quite often when we have events, just as we did for today. One, because people tend to show up at events late, but also secondly, it's a way to educate. So usually the first thing we do at events is show a documentary, a movie, 5-10 minutes, gets people in the room, but also educates at the same time. Then Code then later on, which we will share with attendants, went on to, commissioned a TV station, TVC in Nigeria, to do a follow-up story when the primary healthcare center was finally built. And that was aired on the TV station several times. So I'm not quite sure if that got people interested enough to search about Machina online and then found the video as well. But 10 minutes is a bit long, to be honest, in terms of traction. So also thinking about distribution, as we've talked about, smaller snippets that can be shared online, people's personal stories, some of these individual stories that were captured in the documentary, cutting those out of the larger one and sharing them because it's obviously they're personal stories of individuals. Amy, over to you.
Thank you. I think I'll just start from where Felix stopped off, which is, the videos and the digital. I think what we need to be concerned with, or what we need to remember, is we're asking people to listen to stories and motivate them to action. That, for me, is the critical at the end of the day. If it's stories, Nigerians have stories. They have stories of what we have more stories of what doesn't work than what works. So Laura mentioned about one of the sessions where we asked them to share a personal story and how it led to a cascade of everybody telling their own story. Me too, it happened to me, it happened to me. And we have a lot of people going around saying it happened to me. What we want is or at least what I thought we want, is more people saying, it happened to me, but this is what I did, and this is how I did it, or it happened to me and I never thought I could do it this way. Which leads me to your question, Mr. Elemo, about what were some of the actions that people were able to take. One of the things that came out clearly is people don't know anything about governance. And I'm saying it very nicely. They don't know how to engage. They don't know what their local government is supposed to do. They don't know what their CDC or CDA is supposed to do. They don't even know who they don't know. And you could feel that frustration in many people. I don't know. And for those who know, the inability for them to reach them. Now, a lot of them, it was a 1 hour session, but at the end of the day, and there were many things that I had to take off record, like stop talking. I think I became a motivational speaker at the end of the day, but a lot of them, they had to understand that there's a process. They need to first and foremost understand the process. So what few of them said they were going to do was, one, we're going to educate ourselves better on what the process is or what the process are. So one of their questions was, who do we need to talk to? So many of them took EIE's email, phone number, they took code, oh, we'll reach out to them. Will they do it? To be honest, I don't know, because this was the gap that was missing. There was no sign-up sheet, there was no volunteer sheet, there was no follow-up. A lot of them said, oh, you know, I've been thinking about speaking to my senator or knowing my senator. And after many of them knew that on EIE, for example, you have the names of senators or you have the names of local government, they say, oh, I would do what Amina did, or I would do what Aisha did, which is I'll keep on calling my senator, I'll send a message. Good luck to them. But they said they were going to do that. A few of them said, oh, you know, I'm going to be, understand budget. I feel that even for me, as somebody who has worked in NGO and fairly educated, I'm not PhD yet, I don't even understand budget. And the way it comes across from NGOs, forgive me, it is too technical. So they don't get it. And so what I would give for all of you on this platform, especially for the last person that asked the question, is how to make it less technical. So infographics are great, but what does it mean for Mama Aisha? Or what does it mean for Mr. John? Means nothing to him. He doesn't know what that means. And so it is about making that language or creating a way that they are able to understand it. So almost getting down to their level. And finally, some of the actions that they said they would do is they would reach out to other CSOs in their area, so in their communities. Believe it or not, with the influx of NGOs or CSOs in Nigeria, I had people in the room who don't know any NGO. And I thought that was weird. How can you not know any NGO? In Nigeria, we have 2,000 plus, but many of them don't know. And so perhaps another, like particularly for Sarah and everybody else who's thinking of digital, like a drop-down menu or reference, people can go and click on NGO in Shomolu local government or in Buari local government, look at the NGOs that are there and what they're doing. Information is key, people, and communication is much better. So I think these were some of the actions that came out from what people said they were going to do. But let me say this, majority of them wouldn't do anything, and rightly so, because of the fear. And remember, most of these conversations we had, they saw NSAS, some of them experienced violence themselves. So it wasn't our place or my place to force them to think about what they would do. But the most important thing was many people left there thinking there's hope. It's not that bad. Laura, I'll hand over to you. Thank you.
No, I thought that was extremely eloquent and well put, Amy. I think the one remaining question that you had, Ray, was around which actions would work and actually beget change. And I think that's a really important question and worthy of an entirely different study, a very long-term study, because our focus in this was just really understanding how can we use storytelling as one way to get people to experience a feeling that might motivate them to do something they wouldn't have otherwise, and maybe give them some information about what is possible. In terms of what works, that will take an entirely new study, multi-year, and we would love to take that on.
Excellent. There are no other hands in the room, and we're 3 minutes to our closing time anyway, so that's a that's a good thing in a sense. So perfect timing in terms of questions and flow. So on behalf of EiE Nigeria, R4D, Yemi Adamolekun, I would like to thank everyone for joining us this afternoon, morning, evening, depending on where you are, for this conversation. Please stay in touch. We had wanted people to sort of put in the chat where they're from, but I don't know how we missed that. But we can, I mean, I don't, if it's okay with everyone, we could share a list of people who are on the call and their organizations and circulate that if that will be okay with you. If you don't want yours, let us know so we don't share it, just so people can connect. Thank you, Ray. So thank you. We don't know how this would evolve or morph, but do let us know how you're using storytelling. If you have other interesting stories of impact, if you have other areas you think we should look at or we can think about, we would be glad to hear it. And on that note, Laura, Amy, any other comments?
No, just wanted to thank everyone so much for your attendance and willingness to share. And I wanted to note that I will send out the presentation that we gave today, and I'll include analysis of the before and after surveys, which I omitted in this presentation for length, but we welcome any feedback or questions from you in the ensuing weeks. So thank you again.
Thank you very much, Laura. Amy, anything from you?
Storytelling works. I witnessed it firsthand. It works. It was awesome. And as someone who was just hired to do this, I was taken back to how important it is we need to get back to the basis. So thank you, EiE R4D, for giving me that opportunity. But more importantly, thank you all for coming and listening. I really wish you well.
Dan, sorry, I just muted Dan. All right, thank you, everyone. So we would, so Tosin, thank God, Fisayo, Ray, there's sharing in the chat group. Thank you very much. And we'll make sure we'll share a list of guests so that people do have a sense of who was in the room with them this afternoon. Thank you, everyone. Enjoy the rest of your afternoon. Bye.
Thank
Bye,
you,
everyone.
thank you,
Bye.
thank
Bye,
you.
Yemi, Laura.
Oh, thank you very much, DK. Oh my God, he's gone. I forgot to thank DK in all my thank yous. But DK. Thank you. Bye.
Thanks all. Bye.
Bye, everyone.